Now let's go over our defibrillator. The Beeling Simulation Center has a Zoll M-Series defibrillator, which has the capabilities of providing monitoring, defibrillation, and pacing with our mannequins. Let's start by looking at how to use the monitor features. After attaching the 3-lead monitor to the mannequin, as we'll describe in each individual mannequin section, we turn the dial, the master dial, to monitor. When the machine comes up, it comes up with a default paddle view, so we need to change our lead to lead 2 by pressing the lead button 2 times. Once we do that, we can see the electrocardiogram. We can record the rhythm strip by pressing the record button once to start, and then again to stop the recorder. We can change the side of the EKG complex if we need to, and if the alarm is going off, we can suspend the alarm if needed. Should your patient require defibrillation, turn the control dial to the defibrillation section. Notice that the energy setting comes up with a default of 120 joules on this biphasic defibrillator. In order to change the energy selection, use the down arrow or up arrow keys to change the energy. Once the machine is set, once the defibrillator is set at the appropriate energy level, press the charge button. Now that the defibrillator is charged and ready to go, clear the patient, and once the patient is clear, press the shock button. When using the paddles, after applying a small amount of conduction jelly, place your sternum paddle and your apex paddle on the mannequin. Should you require a change in the energy setting buttons that are on the left paddle can be used to do that. Once you're at the proper energy setting, press the charge button on the right paddle to charge. Once the defibrillator is set and charged, clear the patient, and then press both orange buttons simultaneously to deliver the shock. To convert the adult paddles to pediatric paddles, press down on the black lever, slide the adult paddle off, exposing the pediatric size paddle. Should the patient require pacing, turn the dial to the pacing section. As you can see, the pacer spikes have appeared before each of the QRS complexes. The rate is set for approximately 70 beats per minute. The milliamperage energy setting is usually set at 0 to begin with. Increase the milliamp setting until capture is achieved. Usually somewhere in the neighborhood of between 70 and 100 milliamps. Once capture is achieved, decrease that setting to the lowest energy required to maintain capture. Check the patient's pulse to make sure that there's also mechanical capture and not only electrical capture. Let's review the cardioversion procedure. After placing the cardioversion pads on the patient, turn the dial to the defibrillator setting. Press the sync button. As you notice, the arrows appear where the monitor is sensing the QRS complex. It is important to time the cardioversion shock to the QRS complex to avoid shocking during the relative refractory period, causing the patient to go into a ventricular fibrillation. Since cardioversion can be accomplished at a much lower energy setting than defibrillation, use the energy select button to lower the amount of energy applied during the shock. Administer adequate sedation to the patient. Once the patient is cleared of all personnel, press the charge button. Once the defibrillator is charged, clear the patient again and press and hold the shock button. It is important to hold the shock button down as the defibrillator times its application of the cardioversion shock to the QRS complex. If the button is pressed for too brief of a time period, the defibrillator will not fire.